Researchers from the New England Journal of Medicine traced the outbreak to a 2-year-old toddler who died in December 2013 in Meliandou, a small village in southeastern Guinea. In March, hospital staff alerted Guinea's Ministry of Health and the medical charity Medecins Sans Frontieres. They reported a mysterious disease in the southeastern regions of Gueckedou, Macenta, Nzerekore, and Kissidougou. It caused fever, diarrhea, and vomiting. It also had a high death rate. Of the first 86 cases, 59 people died. The WHO later confirmed the disease as Ebola. Ebola is a virus that causes problems with how your blood clots. It is known as a hemorrhagic fever virus because the clotting problems lead to internal bleeding, as blood leaks from small blood vessels in your body. The virus also causes inflammation and tissue damage. 5 different species of the virus have been found. Symptoms may appear anywhere from 2 to 21 days after contact with the virus, with an average of 8 to 10 days. The course of the illness typically progresses from dry symptoms initially such as fever, aches, pains, and fatigue, and then progresses to wet symptoms such as diarrhea and vomiting as the person becomes sicker. Primary signs and symptoms of Ebola often include some or several of the following: fever, aches and pains, such as severe headache and muscle and joint pain, weakness and fatigue, sore throat, loss of appetite. Gastrointestinal symptoms include abdominal pain, diarrhea, and vomiting, unexplained hemorrhaging, bleeding, or bruising. Other symptoms may include red eyes, skin rash, and hiccups. Many common illnesses can have the same symptoms as EVD, including influenza, malaria, or typhoid fever. Let's find out how it is transmitted. Ebola is spread through direct contact with body fluids, blood, saliva, sweat, tears, mucus, vomit, feces, breast milk, urine, and semen of people infected with it. It is also spread by touching things that have been contaminated with these fluids. Since 1976, the Democratic Republic of the Congo has had the most Ebola outbreaks. Most outbreaks begin in remote areas. Experts theorize that heavily forested areas containing infected fruit bats may be to blame for the multiple outbreaks in the Democratic Republic of the Congo. Other countries with multiple outbreaks include Uganda, South Sudan, and Gabon. The largest Ebola outbreak in history was first reported in March 2014 and declared over by the World Health Organization on June 10, 2016. While the epidemic spread to other parts of Africa, Europe, and the United States, the largest impact was in Guinea, Sierra Leone, and Liberia, the epicenter of the outbreak. Over the duration of this epidemic, there were 28616 suspected, probable, and confirmed cases from these 3 countries and 11310 deaths. The Ministry of Health of the Democratic Republic of the Congo declared an outbreak of Ebola virus disease on the 7th of February 2021 after the laboratory confirmation of 1 case in Butembo, North Kivu Province. Genetic sequencing analysis indicates that this outbreak is linked to the 2-year-long outbreak that took place in North Kivu and Ituri provinces from 2018 to 2020, but the infection source is yet to be determined. The response was coordinated by the Provincial Department of Health in collaboration with WHO and partners, who had nearly 60 experts on the ground, and as soon as the outbreak was declared, helped local workers to trace contacts, provide treatment, engage communities, and vaccinate nearly 2,000 people at high risk, including over 500 frontline workers. 11 confirmed cases and 1 probable case, 6 deaths, and 6 recoveries were recorded in 4 health zones. The outbreak was declared over on the 3rd of May 2021. WHO continues to work with the Democratic Republic of the Congo to fight other public health problems such as outbreaks of measles and cholera, the COVID-19 pandemic, and a weak health system. The question remains as to why Ebola is most prevalent in African countries. Scientists believe that Ebola keeps emerging in African countries, particularly the Democratic Republic of the Congo, because of the prevalence of fruit bats that live there. The Democratic Republic of the Congo contains millions of acres of dense forest that many wildlife species call home. However, this is just a hypothesis, and scientists still are not certain that this is why the Democratic Republic of the Congo has had more Ebola outbreaks than any other country. Living or working in a remote area where there is a large population of fruit bats seems to increase the risk of coming into contact with contaminated surfaces or animals. The amount of financial losses that Ebola-affected countries have suffered is beyond your imagination. When Ebola breaks out in a country, it becomes a priority to contain the virus and prevent it from spreading across borders or between individuals. It is necessary to take preventive measures to keep a widespread outbreak from happening. However, the steps needed to control and contain Ebola takes a toll on the economy. As a result of the Ebola epidemic in 2014, household incomes went down and poverty grew in the countries hit hardest by the virus. According to the World Bank's updated 2016 report, the overall impact of the Ebola epidemic on Liberia, Guinea, and Sierra Leone was estimated at $2.8 billion. A more recent study published in the Journal of Infectious Diseases estimates the total economic and societal costs of the epidemic to be $53 billion. However, during the epidemic in these African countries, many countries came forward to help them. The United States donated approximately $2.3 billion to fight the Ebola epidemic and fund response activities. Other countries such as Germany and the United Kingdom also donated millions to the international Ebola response. By the end of 2015, more than $3 billion was spent to fight the epidemic. Surprisingly, no cure for Ebola has yet been discovered, although vaccines and drug therapies are being developed and tested. Any area where an outbreak happens should be immediately quarantined, and people who have the infection should be treated in isolation in intensive care, since there is no effective treatment right now. So when living in or traveling to a region where the Ebola virus is potentially present, there are a number of ways to protect yourself and prevent the spread of EVD. Avoid contact with blood and body fluids such as urine, feces, saliva, sweat, vomit, breast milk, amniotic fluid, semen, and vaginal fluids of people who are sick. Avoid contact with items that may have come in contact with an infected person's blood or body fluids such as clothes, bedding, needles, and medical equipment. Avoid contact with bats, forest antelopes, and non-human primates such as monkeys and chimpanzees' blood, fluids, or raw meat prepared from these or unknown animals' bush meat. These same prevention methods should be used when living in or traveling to an area experiencing an Ebola outbreak. After returning from an area experiencing an Ebola outbreak, people should monitor their health for 21 days and seek medical care immediately if they develop symptoms of EVD. There is currently no approved vaccine for Ebola, but there is a trial vaccine that proved highly protective against Ebola in a major trial in Guinea. It can be used to protect people who are at high risk of getting the disease, such as close family members of Ebola patients or healthcare workers who are treating people with Ebola. The vaccine is free and participation is voluntary. More than 96,000 people have been vaccinated against Ebola in DRC so far. To prevent Ebola from spreading from one person to another, people with symptoms need to be isolated. So, there need to be isolation and triage areas at health centers where people receive medical care for Ebola. Local health workers need to be trained, and houses and centers where infected patients have been needing to be cleaned and disinfected. Always remember, prevention is better than cure. Stay with the health coach to get more health-related informative videos like this. Till then, stay healthy.